This episode of Let's Talk Natural Medicine is brought to you by BioGlan MedLab, proud platinum partners of ATMS. Built on 50 plus years of healthcare experience and nutritional science, BioGlan MedLab delivers practitioner-only formulas, trusted by practitioners, loved by families. Hello, everyone. Welcome to Let's Talk Natural Medicine, the Legend series. And today I am joined with Diana Mund. She's a naturopathic herbalist, iridologist, a former nurse and midwife with nearly 3 decades of contribution to the natural medicine practitioners society and profession. And so Diana's journey began in childhood, I believe. We're going to explore that. It evolved
Oh,
through
yes.
nursing and clinical pharmacology, training with the legendary Dorothy Hall to allow her to shape a really deeply holistic, people-centered approach to care. So welcome to the program, Diana.
Thank you very much, Annie. It's a privilege to be part of what you're doing. And I think it's great for the younger people coming through to hear a little bit about our experience.
It
Yeah.
sure is great. And I'm looking forward to our conversation. And your story begins at around the age of 4, where you somehow read a book called Nurse Nancy. Tell me about that. What do you remember about that moment and how did it set up your future?
Yeah, it was very clear. One of those little golden books. I don't know whether they still have them today. And on the inside cover, it had, I think, 3 or 4 Band-Aids. And Nurse Nancy would have her little trolley and go around the neighbourhood fixing up all the children that had hurt themselves. So that's when I decided I wanted to work in the healing area. I just knew from that time on. And I didn't know in what area then, of course, but that's all I've always in my, what am I, 74 this week. So in my whole life, it's always been working in the healing area in all
Mm.
different roles. Yeah.
So you were the child at school who offered everybody to, I'll put that Band-Aid on you and I'll help you with a little sling and I'll help you get to sick bay. I love it, people who just go, I just know I'm a healer and a supportive, you know. So would you say you're a sensitive empath or not?
No, but quite intuitive,
Hmm.
more intuitive than sensitive. Yeah. And I think I had to learn very early on because the nursing training was going from a 4-year course to a 3-year course when I started my general training.
Right.
At the age of 18, I was in charge because there was a big gap and there weren't enough nurses. This is a Prince Henry Hospital. And there weren't, so we had to take charge of the ward. And there were 80 that started and only 40 graduated because it was a big ask. Because it was, so you either had to adapt or you just burn out.
Mhm. It was actually so hard back in the day. And as a fellow nurse, I started as a nurse. I have such respect for you because you were virtually in training and being put in. As soon as the day you finish, you suddenly got all this responsibility. And I must admit, most people have got no idea as to how much responsibility you had. But that's a pretty high attrition rate, I must say. So we could probably then say deduct that the people who were meant to be nurses kind of stuck it out and hopefully the nursing profession has gone onwards and upwards. So you started nursing and then you actually did the extra qualification in midwifery, and I think you even worked in theatres. Is that right?
Yes, the third certificate was operating theatre management at RPA. That was the third certificate. Yeah.
Mm. And why did you choose those areas?
Because I just loved learning, absolutely
Mm.
loved learning. And then also worked in pathology as well for a long time, private pathology and general pathology down at the Austin in Melbourne. I worked with the researcher down there, Peter Castaldi, the hematologist, and did the
Hmm.
blood screen antibodies. Like, had some wonderful background work, and I just love learning anything new. Yeah.
You're a sponge. And those professions, I mean, they teach you so much, like intimately around the human body, but also around healing. So you've gone from, and I know you've even worked in clinical pharmacology and drug trials as well. So you've certainly had a very extensive mainstream medical foundation, if you like. What did that teach you then about healing, and why did you then head into natural therapies?
Yeah, where it really happened was when I was working clinical pharmacology. I ran the drug trials, and it was at a university. I won't say which university. And the one of the top guys, they were in charge of the TGA, and
Hmm.
one of them was my boss was honest, but the other person higher than him was corrupt,
Wow.
and and also my direct boss let me know what was really going on. This was in the late 80s. So the
Hmm.
writing was on the wall, and I thought, really, apart from midwifery and operating theatre management, I really enjoyed that. But I didn't want to stay. It made me just consider other options. So then
Mm.
I started a long journey exploring natural therapies from starting to do Tai Chi. I was already doing yoga from a long time, and I then retrained in breath work. They used to call it rebirthing. So I ran a practice in Bondi Junction for about 9 years, and then
Wow.
I had all these naturopaths around me, and with their herbs and things, and I used to love the smell of them, and I think, oh wow, that's interesting. And then eventually I was um, guided into maybe train as a naturopath. So I went and did a few courses and went around to all the different colleges then. And then I went and did summer camp courses with Dorothy Hall. And then I knew then that's who I wanted to train with, but she had a long waiting list. She
She was
said,
guru.
yeah, and I said, well, I know you're the one I'm to train with. She said, well, all right, you'll go on the waiting list, but you've got a lot ahead. But
Mm.
lo and behold, within 6 months, I managed to get in. And then the first year training with her was very, very hard because I was thinking more from a Western medicine point of view, and I'd just get red lines through all the
Oh,
and whatever, and
yeah.
it was really hard. And I thought, when am I ever going to think naturopathically? And
Mm.
eventually one day it just happened. And then I really immersed myself more. And she ended up giving me the award at the end for the most outstanding student. But
Wow.
it wasn't easy. She was a hard taskmaster.
Mm.
But I'm so grateful for the training, especially the iridology and the constitutional prescribing, which has just made me successful with the work
Mm.
in the herbs. Yeah.
For those who are listening in, what does that mean? What did you do with iridology? What does that mean?
So when she teaches you iridology, you learn about the different constitutions, but also not only that, the astrological influence of the herbs.
Mm.
Well, so then you've got to learn how each constitution is different. And then for each constitution, whether they're a silk, whether they're a linen, iris, and their astrological influence of when they were born, and the herbs and the bark flower remedies that are apt for those people, that's when you get incredible healing. And
Mm.
because you get to know them, and you see it time after time after time in clinic, people coming in with those same problems with those constitutions, and then it starts to open up and it becomes alive and just so amazing. Like, and you grow to love the herbs more personally and
Mm.
see them working. And I've been very fortunate because I've been photographing the iris for 30 years, and we do before and after. I've got a really wonderful software that
Mm.
does before and after each treatment. So the client or the patient can see for themselves the changes.
How
So,
fascinating.
yeah, with the treatment. So it's wonderful, very accurate work, and I'm just so grateful that I trained with her and then since then I've done lots of other things as well, trained in sclerology, foot glyphology with Dr. Jack Tips from America, and other iridology courses and nutritional. I'm one for doing really getting myself informed, and I'm not sure of anything I'll look for. I'm trained now in genetic testing. We do the genetic variant testing. I train with the Fit Genes people. Been doing that for over 9 years now. And that's made my practice even more accurate, because when you know where people's genetic variants are, it makes everything more accurate with the treatment.
I love your scholar approach to, learning. Goodness me, what a portfolio of qualifications. But I think it's just been a journey for you, hasn't it? It's probably just fascinating. It's just another bow, feather in your bow. But also, I love what you said there about, Dorothy was a hard taskmaster and it wasn't easy. And I think pioneers like that, it's great that she was going for a certain standard, and it's like, and it was not negotiable. I think everyone who comes through a learning like that sort of goes, yeah, it was really hard, but I'm so glad I did it that way. Now, I know Dorothy spoke to you about being a people watcher. What does that mean?
Yeah, so that was one of the main things. And she said you can do it at airports or waiting rooms, or that's why we don't do fill-in surveys before we see the person, because whether the person arrives on time, whether they're late, how they sit in the chair, how they walk, everything is showing us a picture of the remedies that they're needing, and also their constitution. So she said, become people watchers. And the other thing she said, don't believe a word I've said, go out and practice, see whether what I've taught you comes true.
And it all came true?
Yeah, well, you start to see in practice. She said, practice as soon as you can. Don't leave it too long, because then you're going to see it working for yourself, and then it's going to be more intimate and intuitive for you. Yeah.
So what were all your nursing and medical colleagues saying while you're going on this journey? Did you stay in touch? Did they think you're crazy?
Um, Not at all. They thought I was brave
Wow, you
and
were
like to
brave.
do another 4 years study again.
Yes.
And because I was in my early 40s then, and I had a newborn baby, because my last child was born at 44.
Wow.
But I just loved it. I'd get up every morning at 4 a.m. That was the best time for me to study, till 7 every morning. And then do my all day Sunday. My husband would look after the children. I'd spend that day doing assignments. So but I absolutely loved it. I loved the learning, and it was magical,
Mm.
magical the way that she taught. Yeah.
What a great word to use, magical. So we have natural medicine awards today, and they're a big part of the Australian Traditional Medicine Society and our members. And you were the most outstanding student under Dorothy Hall. What does recognition mean what did it mean to you, and what does it mean for people today? Why should we recognise people more?
I just think it helps with motivation and honouring that if you do the work and you're prepared to uh, take the knocks as well and apply yourself and be humble enough to ask for help.
Mm,
There's always help. There's so much help around
mm,
that you you can achieve. What you want to do with the work, but to me, it's like having your heart in the work. Your heart's there. You don't really need the motivation, and then having that recognition is just a side
mm,
thing. It's not. It's lovely, but I think it also inspires and encourages people to um, maybe they can learn through some of the things that you've done to help you. And I think we all need inspiration. Yeah.
Exactly. Now, you navigated building a practice around raising your young children at the time, busy family life. How did you do that without burning out and, showing those, because they're the people that you're usually coming to see you who have lost the balance. How was it for you as a practitioner to keep that balance?
Yeah. So starting out, we purpose built our home, and then so my clinic was part of the home but separate. And then as I got busier, I had some associates work with me because I was still, had the children to get to school and all the things there. So I just worked around, and like when I first started out, I think one of the most important things for people starting out is to allow time in your diary for the work. So even if you're not busy, I would allow, say I'm working 3 days a week. So in those times when I didn't have clients, I'd do something towards the practice. I wouldn't go out shopping or think, oh, that's good, no one's here. I'd always make a space for that work to come, and it did. It's very easy when you're not busy to do other things, but I think it's important to hold that space for the creative forces to come in and create things for you in the practice, and establish trust with your clients or patients. If you can establish trust, people refer to you. And that's, to me, it's one of the most important things. Have an open heart and establish trust. Spend time doing that. Yeah. To me, one of the main ways of establishing trust is to if you say you're going to do something, like there might be tiny little things, do them. So it's really important to be authentic and honest. So, and it's the little things that matter. Yeah.
Sure is. Consistency of the little things creates the amazing big things. Did you have a vision or a mission or something that was just really crystal clear of who you
Yes.
wanted to be and what success would look like for you?
Yes, I have a mission statement. I did that right at the very beginning, and it's to build better health in all aspects. Our mission statement is to build better health in all aspects of your being. Yeah. And then my first brochure had Paracelsus's quote on the brochure, which is still on my brochure today, which is one of my favourite. He was an amazing healer, Paracelsus. He was the father of pharmacology. In the 1400s, he says, all mankind needs for good health and healing is provided in nature. The challenge for science is to find it. I love that quote.
I think when you have a mission or a vision that's really clear and that you can, articulate clearly, it helps you then guide those decisions because you're making decisions every day, and you've just referred to even the way you had to spend your time so that you just make the most of all of that 3 days a week. I think that is probably one of the reasons that you have been successful, that focusing on the vision and the mission that you wanted to achieve. Now, you mentioned that you really do love herbs. I'm hearing that come out on, and even what you said about your mission statement and loving quotes from herbs and nature. How has that sort of resulted in some tangible treatment outcomes you could share? Do you have any cases that you look back and go, I'm so glad I studied herbal medicine because that helped those people?
Yeah, there's quite a few. One in particular, it was quite astounding. She was an eight-year-old girl that came to me. Her father brought her in to see me, and she had very bad psoriatic arthritis from an infant, and she'd lost an eye. and so she's blind in one eye. And they brought it to me. They've been referred to me because the professor of rheumatology had said there's nothing more they could do, and she was on 16 medication and she was just progressively getting worse. And they
Wow.
thought she might lose the sight of the other eye. So I didn't know how I'd go, and she was on so much medication. And I had to establish trust with the parents. They'd never done natural therapies before.
Ooh.
And so eventually it took about 3 blood cycles, about 9 months. We worked 5 blood cycles. We got her off all the medication. She was well again and fit to go to school. And she was a very intelligent young girl. And she came back to see me this year, and she's now at university and
Oh.
was going to become a doctor, but she's now doing some other course. Very, very bright girl. And then the father kept saying to me, oh, the professor wants to talk to you about your treatment. And I said, well, I don't talk to doctors over the phone unless you prearrange it, because it could be anyone, legally.
Yes.
I eventually, he spoke to me over the phone when the father was present and Sophie was present. And he said, I just want to congratulate you on the treatment. And he said,
Wow.
this case has been presented at our overseas conference on the beauties of natural medicine and what it can do.
Oh, congratulations.
Yeah. And lo and behold, when I found out his name, I worked with him when I was a student nurse, when he was a registrar in paediatrics. Can you believe that?
Incredible. Absolutely
Like
incredible.
synchronicity.
Yeah.
Yeah. So that's one. There's been so many over the years, which I just feel so grateful to have the knowledge and to be able to help people that
Is that a common trend? People have tried everything else, or they've tried,
yeah.
Western medical approach. So it's kind of like they arrive at you more desperate.
Yes, on lots of medication. And then I had a COVID vaccine injury. He's a top triathlon athlete. Spent $20,000. He'd had hyperbaric chamber work. He'd had ozone therapy. He'd been to see 2 or 3 integrative doctors. He came in with a bag full of supplements, so big, no better. So anyway, just did basic things with the herbs and just a couple of supplements. And he shifted and he's going really well now. And I see him probably every 6 months. But so he got his faith back into natural medicine. But you really need, in cases like that, the liquid herbs. No supplements will, you've really got to get in there and work with cleaning up, strengthening. And there's nothing like a herbal tonic made up just for you. And now I see this is what happens. You help one person, then you see all the family, they come. So we've got all families that come to our practice. And which is good because we can treat anything if we work naturopathically, no matter what it is.
It's probably very handy working with families too, because you've got all those genetic links as well.
Yeah, absolutely. And it's like, and they see someone in the family helped, and so they've got faith as well. And there's another naturopath that works here with me, which is wonderful. There's always been a couple around that, because I'm working a little bit less now. I'm in my 70s.
It's not surprising. You're in your 70s. I think you said before you're 74. And how many hours a week are you still working?
I'm doing 1, 2, 3, about 4 days one week and about 3 the next. But then I've got admin on top of that because I run the centre. There's other modalities that work here.
So you're
practitioner.
probably actually doing a full load for most mere mortals, and but for you, you've slowed down. I love that. And you've also done over the years, you've taught postgraduate students, you've
Oh,
mentored
yes,
many
the mentoring.
aspiring practitioners, and often without charge. And you can see you just love it. Why is it so important to just give back
Yeah,
once?
we've been doing that for about 15 years. I learned from the students. And I
Yeah.
just love being around young people. Like I learn something new from nearly every student.
Mm,
And just wonderful to have them here and also to inspire them to work with the herbs more. To
mm,
see, and then when they with that they hang around long enough, they see how herbal medicine really helps. And it inspires them to get to know their herbs more and to some of them we also do nutritionalists, then they want to go on and study naturopathy when they
mm,
see, yeah, they get excited about it. And also they love the iridology because they can see the photos and see the changes as well. So, yeah, we do that as a way of giving back, just to keep, we need to be nurturing the people coming after us,
mm,
inspiring them and helping them. And
mm.
so I also mentor practitioners if they've been out for a while and they just want to come back and just get focused again and just
Mm.
remember what they know again. So
Well, that's it. Like you were told, dive in there quickly because you've got all of that information and
yeah,
you want to
yeah.
start applying it as quickly as possible. And when people have taken breaks, which many women do,
Mhm.
that is a challenge, and it can be a real fear factor for many to go, oh, well, I've been out for too
Yes.
long now. And so to have someone like yourself and says, like, let's just ease back into it
Yeah.
and be
Yeah.
supported in that is a really beautiful role that you have played.
Mm, yeah.
Well, it
It's
sounds like you're quite positive and hopeful about the new students coming through, which is really great to hear.
yes, it's like and especially when they decide that they want to do more, like rather than just be, they want the full naturopathic knowledge.
Mm,
That's and I think we spoke also about like a lot of them were told now it's best to specialize, where they see whole families here and they see how we can treat anything, and so they're seeing a broader picture here too.
mm,
They come. Um, so yeah, so I think that's important to also keep in mind because then a lot of them don't even know what they want to specialize in. I said, well, just learn the
mm.
basics and get practicing, and then it'll come.
Exactly. I
Yeah,
think you don't want to, yes, modern business is all niche, 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 but you don't know what that niche is until you've had that journey. And it's great to get that breadth bedded down
yeah.
for most practitioners. So I think that's great that they're doing that. So at this stage, just to finish up, when you look back
Mm.
on your incredible journey, what are you most proud of?
Oh wow. Home birthing my two children.
Wow. Wow. Why is that the biggest thing?
And also bringing them up with, naturally. I taught myself homeopathy when they were children. And then I've trained in general homeopathy since. I'm not a homeopath. But yeah, to be able to be healthy enough to do that, especially at 44,
Mm.
as you know.
Yes,
Um,
exactly. You would have been considered much higher risk.
yeah, elderly, primate. I wasn't primate, but what else am I? Just, yeah, like, I think that's the main thing. And what was the question again? What am I most
When you look back on your career, what are you most proud of?
that I could like I love teaching, like even the other naturopath that works here with me, because she was a student with me years ago. And she said, oh, I loved your teaching. She said, you're
Mm,
such a good teacher. And I just probably teach by example. So that I've been able to share and inspire others, I suppose, to know that it's such a satisfying, wonderful career to work in naturopathy, and also it inspires you to work on your own health. So, and I like when the doctors see my health and whatever, and they say, "Wow, you know, for your age, you've done so well." and like I'm just on some thyroid medication, and that's it. Like everything's healthy apart from a little bit of pelvic repair post childbirth. So, and that's because of working in naturopathy inspires you to work on your own health, because you need to be an example for what you can achieve. Because I often get women in here at 38 worried that it's too late. And I say, well, I was 44 when I birthed my son. And they go, oh, wow. That's
Amazing.
That's lovely to hear.
It's
So, yeah, they'd be the main things, Annie. Yeah.
Oh, thank you so much for sharing just a glimpse of your career path with us today. Truly fascinating, and I'm super impressed. I must admit, you've just done course after course after course, but I think you can just hear the love of learning. You can hear that you wanted to put it all together to help and serve others. I think those who you have worked with have been really blessed by having someone who is just so credentialed, but also your heart is so in the right place. So thank you for your service to natural medicine. And and for those listening on, wow, there's another example of one of our legends for sure. For those of you who are tuning in as well, if you haven't yet joined our Friends of Natural Medicine community, it's a community of all Australians who are interested in natural medicine. And all you have to do is scan the QR code on this screen if you are watching our video somewhere, or if you are not, go to atms.com.au and click on Friends. It's free to join, and you'll get an email every 2 weeks, and it will then have links to podcasts like this, but you'll also get recipes from celebrity chefs. You'll get blogs by our accredited practitioners. You'll get lots of little secret goodies as well. So come and join us, atms.com.au, click on Friends. We look forward to welcoming you to our community. And for today, thank you so much to Diane. It's been great to have you join us, and stay tuned for our next episode coming soon with another amazing legend of natural medicine. Stay well.
Thank you so much, Annie. A privilege.